So I'm assuming you are here because either you know you have fibroids or you know someone close has fibroids and you suspect you have fibroids, and I'm sure you've read about it. So we'll quickly go over what fibroid is, but we're really here to address any concerns you have and answer your questions. So at the end of the talk, feel free to type in all your questions, or we can maybe unmute the mic so everyone has a chance to ask questions. Okay, again, this is about me. All right, so I was also asked to focus on the topic of fibroid degeneration. I think this is one of the most searched questions by our patients, so we will touch upon that. So what do we know about fibroids? So fibroids is pretty common. 80% of women would have fibroids by the time they reach menopause, and half of those women will have symptoms. And those symptoms range from mild to hard to live with. What causes those symptoms really depends on the location where the fibroid is growing. So here is a diagram of the uterus. So the fibroid can be growing, hopefully you can see my arrow. It can be growing inside the endometrial cavity, and those are called submucosal fibroid, and they can also be growing almost outside of the uterus, and those are called subserosal fibroid, and the fibroid that grows in between in the muscle layers are intramural fibroid, and depends on when they get bigger, they can act like a submucosal fibroid and start protruding into the endometrial cavity where the baby grows, or they can be protruding the other way. Now, as you can see, as it bulges out, it could start bothering its neighbors, right? Uterus sits in between the bowels and the bladder. So when they started putting pressure on the bladder, and then you get those symptoms to feel like you have to pee all the time. When it compresses on the bowel, then that's when you get the symptoms of having a hard time going to the bathroom. And when it compresses on the nerves, and then you can get these vague abdominal pain, or you can get back pain. So, and the other, another major symptom people experience is bleeding. So bleeding could means you bleed a lot during your menstrual period, or it could mean you bleed for a very long time, or you're just having very irregular cycles and bleed in between your periods. And last, it can affect fertility as well. As I mentioned earlier, depending on where they're growing. If they're growing, compressing the fallopian tube, then it's going to block the eggs from coming out and to meet the sperms. And if it's blocking, distorting the uterus, it can make it hard for the baby to implant and grow. So if you have any of those symptoms and you know you have fibroids and they bother you, come get evaluated. When you first come to our clinic, a lot of times we offer a screening ultrasound where we just kind of look with ultrasound to see if you have to make sure you have fibroids. As you can see on the left of the screen, this image shows the L stands for Leo. It's the medical term for fibroids. Basically, there are two of them. And you can see they're very hard to define on ultrasound. So it's a good screening tool, but it's not as accurate as MRI. So if situation, allows, you have no contraindication to MRI, we will most definitely send you for MRI, because MRI is like a 3D photo of your pelvis. As you can see this very same patient with the two fibroids on the MRI, you can see much clearer what they look like and their dimensions. And that's like the middle image. And if you see the right image, that's like looking at a person from the side, and you can see the spine. So then you can see there is another fibroid that couldn't be seen on ultrasound. So ultrasound isn't all inclusive. So sometimes additional fibroids hiding elsewhere could be missed, and you can see all of them and have accurate measurement from MRI. So now let's focus on the topic of fibroid degeneration. The reason it's called fibroid degeneration, it really pathologically to us, it means part of the fibroid is degenerating because it's growing too fast. It's growing outgrow its blood supply. So the part that didn't receive good blood supply can break down into jelly-like material or breaking down into water-like material. But what it really means to you when you go through fibroid degeneration, it's pain. You can get very acute pain as part of the fibroid is degenerating until it can recruit a new vessel again. So it may become a cycle where you have this pain and it goes away, and maybe a few months later you can go through this experience again. So when this is happening, when the fibroid is degenerating, also chemicals are released and your body can respond like you're having an infection. You can have a low-grade fever, and you can have bleeding. You can have increased white blood cell counts. So if it bothers you, come get treated. And we touched upon how it affects the fertility. So if fibroid has been, if you have been told that you have lots of fibroids, and that's something to think about, it could be the reason you're having trouble getting pregnant. So who is a candidate for the procedure we offer, fibroid embolization? I would say for anybody who were ever offered by your gynecologist to have a hysterectomy, then you are a candidate for fibroid embolization. So in our country, there's just thousands of myomectomy is performed. Again, myomectomy is just cutting into the uterus partially, kind of removing each individual fibroids. But as you can imagine, depending on the location, sometimes this can be really hard to do. And also if you have a lot of fibroids, this procedure becomes impossible. And that's when likely hysterectomy is offered to you. That's involving removing the entire uterus. So if you wanted to give it a try to preserve your uterus, embolization would be a good option for you. And I would always encourage all my patients to go get a second opinion from your gynecologist, because I think our job is to really provide you with all the options you have so you can make a good and the best decision for yourself in terms of how you wanted to treat fibroids. So again, just quickly, for those of you who aren't familiar with the embolization procedure, so we're not making any, we don't use a knife, we don't really make any cuts into the uterus. We make a little nick at your skin at where the creases is in your right groin. The cut is the width of your pinky, and we pass up this little catheter that kind of take us to the arteries that supplies the fibroids, and we put in little particles. As you can see, this is what it looks like intraprocedurally. We put in little dye, and that could highlight the artery. Now you can see all these little vessels that outlines the fibroids, and we put in little beads. It kind of just cut off the blood supply to those fibroids, so then they can shrink over time, so give you relief of all the symptoms. So that's it. If if you're interested, come visit us, and we can have a one-on-one discussion on how you would like to treat your fibroids, and go from there.